Hi, Dr. Osborne here with Gluten-Free Society and author of No Grain, No Pain. And tonight I want to talk about leaky gut, an essential guide to recovering. This is such a pervasive and prevalent problem in our society today. So I really want you to walk away from this webinar tonight with a great understanding of what leaky gut is, how it can be caused, and what you can do to fix it and prevent it in the future. So as we do, let's talk a little bit, let's begin the conversation with talking a little bit about gluten. So many people are familiar with gluten and gluten sensitivity, but so few people are really aware of how detrimental it can be and of all the different types of ways that gluten can create an impact or an effect on our health. So as you look in this diagram, as we're looking at the gluten exposure, there's what we call primary effects, and then there's also what we call secondary effects. Now, the primary effects, meaning these are direct effects. So as gluten comes in, these things are created directly as a result of gluten damage. And so as you can see over here, barrier permeability, meaning leaky gut or intestinal hyperpermeability, also permeability of the blood-brain barrier. That BBB stands for blood-brain barrier. So this is one aspect of a primary impact or effect of gluten. But then we also have many other aspects. Autoimmune diseases. We can get direct autoimmune disease within the gut, like celiac disease. You can get Crohn's and ulcerative colitis as an impact of gluten exposure. And then Hashimoto's, which is thyroid disease, as another form of autoimmune disease highly associated with gluten sensitivity. And then we have the effect of gluten on the microbiome. And so this term here, dysbiosis, refers to abnormal bacterial growth within the gut. Then we have some people who have an acute allergic response to gluten. And so an acute IgE response, which can create intestinal pain and diarrhea, kind of some of the classic allergy-based symptoms. Then we can have what's called a delayed antibody response, and these are the things that can occur, and as they occur, they accumulate over time. It's like a slow smoldering fire that does damage to the body over time. It's not acute in the sense that we even recognize the damage happening, but what happens is this subtle underlying damage over time builds and builds into a hyperinflammatory state that can trigger all types of tissue problems. So those are all primary. Again, those are all things that gluten can do directly to an individual. And then we come over here to this other side, and these are the secondary effects. In other words, when these primary things go wrong, these are some of the consequences that follow. And so one of the main ones that we see is nutritional deficiencies. And a lot of that has to do with the changes in the gut. And that can lead to disease like anemia, but anemia being one form. So iron deficiency, as an example, can create anemia. Vitamin B12 deficiency, as an example, can create a different kind of anemia. And then there are other nutritional deficiencies that can be created as well. So this is just, again, an example. And then we have the systemic inflammation impact. So as a secondary effect, when gluten damages the barrier, it allows for chemicals to leak into the bloodstream. The immune system will then begin the attack on those chemicals, creating an inflammation that has access to your bloodstream and subsequently can create organ and tissue degradation and damage. So again, important to understand that gluten can play a huge role in a huge piece of this leaky gut puzzle. So if you're currently not sure whether to go gluten-free, if you're not following a gluten-free diet, or you're kind of following a gluten-free diet, I want you to understand that gluten plays a huge role in the development of leaky gut. It's one of the primary causative factors. This is just another example. A lot of people think of gluten sensitivity as this disease state. In actuality, gluten sensitivity is not a disease at all. Gluten sensitivity is a genetic state. In other words, a person has got genetic markers for gluten sensitivity or they don't. And those with gluten-sensitive genes will react to gluten. That reaction to gluten, those different kinds of reactions I just showed you, those primary and secondary effects. And these are just, again, some of the possible outcomes of gluten exposure. In other words, gluten sensitivity is not a disease, but when people get exposed to gluten, it can cause diseases: celiac disease, bone loss, asthma, fibromyalgia, chronic fatigue, thyroid disease, psychological disease like schizophrenia and bipolar, cancer, specifically lymphomas, as well as joint pain like rheumatoid arthritis and lupus. So A lot of different conditions have been linked or associated or have been shown to be caused directly as a result of gluten sensitivity. Now, I think it's also important tonight as we're talking, as we're getting to this leaky gut piece, that we also understand some fundamental differences in terminology and definitions. In allergy, we hear a lot about gluten, and then we hear the word allergy followed, so gluten allergy, and then we sometimes hear gluten intolerance, or sometimes we hear the word gluten sensitivity. I want to really define what these things are. An allergy is a type of an immune reaction. And traditionally, you've got two kinds of main allergies. You've got acute, which is this IgE antibody response. Now, that particular response is typically, if you go to the allergist and they do a skin prick test, that's typically what's being measured. So if you've had this type of testing done, understand that your doctor was testing you for acute allergies. And acute allergies, of course, lead to a chemical inflammation or can lead to a systemic chemical inflammation that causes tissue damage. Kind of some of the more common symptoms here would be like breaking out in hives, or your lips swelling, or your throat constricting, or your eyes and having watery, teary, itchy eyes, etc. Those are kind of acute symptoms, if you will. But then we have this whole other side of the equation as it relates to allergies. We have this delayed hypersensitivity response. And so understand that these are time differentials. An acute allergy occurs generally within 30 minutes of exposure, whereas a delayed hypersensitivity can occur anywhere from 3 hours to 3 weeks after exposure. And so they can be a lot harder to identify. Now, if you've ever been tested for celiac disease, you've only actually been tested for that one IgG type of reaction. Typically, they're measuring something called an antibody to gliadin, alpha gliadin, which is a type of gluten. So they're measuring an IgG antibody toward alpha gliadin. That's what the celiac tests measure. So understand that if you have been tested for celiac disease in that way and come back and tested negative in your blood, that doesn't necessarily mean you don't have gluten sensitivity. It just means that you don't have the particular antibody to the particular type of gluten found in wheat, barley, and rye. And that's all that means. Remember, there are more than 1,000 different forms of gluten. So if we only measure one potential way that you can react to one type of gluten, we're not really being comprehensive. Now, I say all that because these other things that I'm pointing out now are items that are very, very rarely tested. In other words, not very many doctors are actually measuring IgA and IgM and IgD. Not very many doctors are measuring immune complex reactions or T-cell reactions. And this is one of the reasons, again, in laboratory, why so many people will get tested for gluten and they'll come back negative and they feel better even though they go on a gluten-free diet. It's because they don't feel better because they're wrong. They feel better because they actually are gluten sensitive, but the test was wrong or the test was not accurate enough. And then we have this other terminology, right? This gluten intolerance terminology. I think it's important to point a couple things out. An intolerance means that you don't digest something. An intolerance is not an immune reaction. So again, if we go, I would just go backward here. Remember that allergy is an immune reaction, okay? Very specifically, an intolerance is an inability to digest. So most people are familiar with lactose intolerance. Lactose is a type of sugar in dairy. It can be very, very difficult to digest, and that's what we call it, lactose intolerance. Well, gluten intolerance, you want to think of it much in the same way. What happens here is that inability to digest gluten leads to a fermentation process within the gut, causing changes in gut bacteria, but also can lead to a leaky gut or an intestinal permeability. So now back to the topic at hand tonight is this leaky gut piece, right? And so gluten intolerance in and of itself can cause a leaky gut. But then we can also see that with gluten, there's this other aspect. So we can get leaky gut by creating gut dysbiosis and then getting to leaky gut, in other words, going this side of the equation. But we can also develop leaky gut because it's been shown, gluten has been shown to dismantle this very, very important protein that seals the gut lining called zonulin. And so when gluten dismantles these tight junctions, it can also create this permeability. And then what happens when the gut is permeable is we acquire allergies. Now, I'm going to move backward again here because this is, again, allergies. You don't necessarily have to be born with a lot of food allergies, but if you develop a leaky gut, you can start to acquire a number of different food allergies, and then this whole process can kick in. So again, it's important to understand that an acquired allergy can develop as a result of a leaky gut. So the more problems we have with a permeable gut, the more allergies we develop over time, the more allergic we become. So, one of the classic stories I hear in my clinic is, Dr. Osborne, I've been eating these foods my whole life, and it was only 3 years ago that I actually started to develop all these food allergies. Why is that? Well, one of the reasons why has to do with the development of leaky gut. Remember, our guts are strong, our guts are resilient, and they don't just become leaky all of a sudden. Usually there's years of damage. So leaky gut can be caused by a number of different things. Gluten is part of that group, and as we'll get into tonight, you'll see that years of damage can contribute to a leaky gut, so that we can hit a threshold where the gut breaks open and we start to develop allergies later in life as opposed to developing them earlier in life. And remember that allergies create tissue damage, and if they're there long enough, subsequently they create disease. Now, there's one other kind of complex reaction that can occur with this process as well, and that has to do with the gluten intolerance leading to an inability to digest the gluten. That leads to the production of immune system antibodies and inflammatory chemicals, which those can then cause a leaky gut. They can also independently cause a tissue damage. And so we've got all these things working kind of in part, but also in whole. Together, they're working and there's different mechanisms of action. So I just want you to kind of see this complex overview so that you better understand and get a hold on it. Now, let's talk a little bit about perspective, because many of you struggle with leaky gut. And so I like to start from the premise of perspective, and that is disease. Remember what disease is. It's the accumulation of years of damage. We don't just wake up one day and we're perfectly healthy and the next day we have disease. We develop chronic degenerative diseases, autoimmune diseases, over accumulation of years of damage. And so again, this damage is a conglomeration of environmental bludgeoning. In essence, environment meaning chemicals in the environment, pesticides, eating the wrong foods, not sleeping well enough, not exercising, being under too much stress. These are all environmental processes that can weaken our body's immune system, that can weaken our body's resources. And repairing years of damage, takes time. Some people want to be impatient with leaky gut. They want it fixed in a week. They want it fixed in a month. And sometimes it takes longer than that. So I want you to understand that many of you may have already gone gluten-free and you're still suffering with this leaky gut issue. Removing gluten does not repair the damage. It only stops one of the many poisons that are entering the body. It doesn't repair the damage. It only stops the persistent damage that's ongoing. And it's important to understand that. I'm going to use an analogy. If you roll over a nail and you pop your tire, you can remove the nail from the tire, but the damage to the tire is still done. In other words, removing the nail doesn't repair your tire, just like removing gluten doesn't repair your leaky gut. So although stopping the poison is certainly going to be helpful, and it's a critical first step, it won't address all of the other potential environmental factors that are contributing to poor health and leaky gut. And so here's the perspective. This is your gut after years of gluten exposure. It's on fire. It's on fire. It's damaged. This is you when you're first going gluten-free. It's like pouring small buckets of water, on a raging fire. Initially, in order to gain traction to put the fire out, you've got to start with one small bucket, and you've got to move into bringing in hoses and bringing in helicopters full of water. And so when your gut is initially inflamed, when you're very, very sick, this is where most people are. And as long as you have this perspective, know that there's a way to come back from this. But the way to come back from this isn't just throwing small buckets of water on the fire. We've got to be comprehensive in our approach. And so removing gluten is only one aspect to the comprehensive approach that we're going to be talking about tonight. So let's talk gluten, the path to disease. So undiagnosed, there's this place, again, people with gluten sensitivity, it's not something that they necessarily developed. It's something that they've always had. It's genetic. Either your body likes gluten or your body doesn't like gluten. And so, but the issue is that the body is strong and resilient. So you might get gluten exposure early on in life and be just fine with it, or at least not be sick over it. But the more exposure over time you get, the more damage that exposure does. And so this is typically this top box, right? Undiagnosed, typically little symptoms. The gluten-induced damage combined with other poor choices is in the process, the early process of building, right? And then over time, we get this progression to what's called subclinical problems. So these are the problems that we're talking about tonight. Leaky gut. Leaky gut is not always symptomatic. Intestinal hyperpermeability is not always symptomatic. What happens usually first is we break some holes in the gut, and then over time, those holes allow things to leak through and do more and more and more damage. And so again, that's why leaky gut begins as a subclinical issue. And we develop and we acquire more and more allergies to the environment, more and more allergies to food. And then as that problem festers and manifests stronger and stronger, we begin to recognize that there is a problem. We begin to recognize that this list of symptoms start to appear: fatigue, brain fog, hair loss, chronic stomach pain, chronic joint pain, Hashimoto's, thyroid pain. There's all these different forms of pain, right? And that's at that point, by the time we get that diagnosis, we've been clinically progressing to the path to disease for years. And so that by the time, and remember, this process can take 20 to 30 years. And I want you to understand that because your body is so smart and it's so intelligent and it's so resilient, it won't just kick over and be sick automatically. It took 30 years for you to get sick. So back to that perspective, you're not going to necessarily heal overnight. This is 30 years of progressive damage. So you want to have a realistic expectation as you move forward. But once that problem sets in, we diagnose the illness, we diagnose the disease. Typically, it's one of an autoimmune in nature, and it's diagnosed because of inflammatory changes and inflammatory symptoms. Now, as it relates to gluten and grain, there's really four kind of classic mechanisms of damage that occur. One of them is inflammation directly. So gluten in and of itself can cause direct inflammation. That damages the body, weakens the body's reserve. Gluten itself can lead to changes in good bacteria. In other words, it can alter our microbiomes. Our microbiomes are absolutely critical for our immune systems to function, for us to be able to make vitamins, for us to be able to process our food, digest our food. The bacteria is very, very critical. One of the other mechanisms of grain-induced damage is this process called, again, leaky gut. And that has to do with those little anchoring proteins within the gut that becoming dismantled as a result of grain exposure. And so we can, with a leaky gut, we can develop autoimmune diseases. We can develop increased food allergies that then lead to other problems. One of the other mechanisms of grain-induced damage has to do with the intolerance bit, the digestive, the inability to digest, that can lead to gut damage and nutritional deficiencies and symptoms of irritable bowel, gas, bloating, etc. And then again down here, we talked about altered changes in good bacteria up here, but now those altered healthy gut bacteria, now we become susceptible to chronic yeast. Now we become susceptible to more immune system stress. So these are those primary mechanisms. One of the reasons why going gluten-free is not enough. Grain-free is going to be the next step in your success to your process of healing and recovery. Remember that disease is always multifactorial. Once you become ill, healing may require more than just the removal of gluten and grains. And in my experience in my clinic, it always is that case. It's always that way. Going gluten-free is the beginning of the process. It's the initial water buckets going on the fire, but it's not the sole. It's not the sole solution. Remember, the toxic burden, the years of toxic buildup and burden, impact the function of multiple tissues in your body. So by the time that you develop disease and illness, your liver's compromised, your immune system's compromised, your gut's compromised, your skin, your lungs. All these tissues are compromised. None of them are working at full capacity. So you're not going to heal overnight because these tissues have all been compromised and they're not working at full capacity either. Now, if we look at the National Library of Medicine research on gluten and leaky gut, I put this slide up just because so many people go to their doctor and they mention leaky gut and they get laughed out of the room. And even if you mention intestinal permeability, a lot of GI doctors will tell you it just doesn't exist. Shame on those guys. They don't read their own literature. They don't read their own research. This is a slide coming directly from the National Library of Public Medicine. Okay, so anybody in the world can get access to this, but especially doctors. And you can see over 207 studies that have been performed or that have been done showing a connection or correlation between gluten and intestinal permeability. We can do similar research findings. You can see gluten and acid reflux. A number of studies show a correlation. Gluten and irritable bowel syndrome. A number of studies showing a correlation. So I just want you to see that piece, because again, I know a lot of you are up against doctors who are telling you that that you're crazy and that it's all in your head. And I'm here to tell you that you're not crazy and that it's not in your head, and that it's very scientifically validated. So let's talk about some of these toxic exposures. One of the biggest toxic exposures once leaky gut develops especially can be food. Now it can even be healthy food. So we say food, and so in defining food, I have to really be very clear in what I mean about food. I mean real food. I mean food that is grown without the use of chemicals. I'm not talking about processed food product. I'm talking about actually real food, fruits, vegetables, nuts, meats that are real and untainted. So food, but some people have food allergies, right, because of the leaky gut. So food can become a toxic exposure, even though maybe it wasn't originally the cause of the illness. It becomes a perpetuator of the illness. So medications, there are a number of different medications that can disrupt gastrointestinal function and contribute to leaky gut. We'll talk more about those shortly. Household products and cleaners, the quality of indoor air, these are potential toxic exposures. Toxins in the water like fluoride and other chemicals that we find, depending on your community and where you live. And then heavy metals in the environment like lead and mercury and arsenic and cadmium, and biotoxins that are emitted. Perfect example of a biotoxin is a mycotoxin. It's a form of mold toxin that's emitted in a lot of our foods. So again, these are examples of toxic exposures that once we have leaky gut, we're even more susceptible to these things. Again, it's not that these things are necessarily causing the disease. It's that the disease, the leaky gut, is already there, and these things just make it really, really hard to heal. So if you don't know, how to address these issues, or if you're not addressing these issues, the road to healing becomes much slower and much more challenging. So again, leaky gut. It occurs when tight junctions are damaged. In this diagram, these are gut cells you can see these little lines or dashes here. These are the tight junctions. These are these proteins that snap the cells together that prevent gaps, big gaps, from forming in between the cells. Because when things can leak through, remember your bloodstream is right here. And so chemicals and toxins can access your bloodstream, leading to immune abnormalities that lead to increased food allergy, leads to autoimmune pain. It's a process. And so again, step one of the process is to remove the things that can contribute to the leaky gut or that can cause the leaky gut itself. And so these are some of those environmental factors. Gluten, perfect example of something we know can cause leaky gut. Food allergies, and that's the catch-22, right? If gluten was what originally caused the leaky gut, but you develop food allergies as a result of the leaky gut, and the leaky gut never goes away until we address the food allergy piece, right? And that's the piece of information that so many people are missing. Pollution, stress, GMO, which is genetically modified organisms, and then medications. These are all just examples of environmental factors that increase gluten sensitivity symptoms, but also perpetuate that process of a leaky gut. This is just a diagram of the standard American diet, and maybe you're on this type of diet now and you're looking for a solution and an answer. But most people's food guide pyramid looks very much like this. Grain is the staple, dairy is the sub-staple, and sugar comes a close third. And so if this is what your diet currently looks like, just know that you're in for some big changes in your health. You're in for some big improvements in your health if you take this pyramid and you change it and you put it at the base of this pyramid. What you really want is you want meats and healthy vegetables. Those are going to be some of the staple core foods that are going to help you get healthy. So let's talk a little bit about why we eat. So a lot of people look at food as this social thing, because we celebrate with food, we show love with food. It's a very, very much an entrenched social element, and sometimes to get healthy we have to step outside of that element, and we have to be very stoic about our behavior if we want to get better, because the years of accumulated damage requires a little bit more of an aggressive action on our part. So why do we eat? We eat to generate energy. We eat to promote normal tissue repair, growth, and balance. We eat to maintain nourishment and what's something called homeodynamics or homeostasis for many of you who took biology in college. But the bottom line is we eat for the healthy function of the body. Now, these are what I call the 4 horsemen of the GI apocalypse. In other words, these are the things that, that we get the most exposure to in our modern day environment that do the most damage contributing to leaky gut. Chemicals, gluten, infections, and genetically modified organisms. And so we're going to go through these and talk a little bit more in detail about this. Fruit, and this is part of that chemical category, and I call it fruit or frankenfood because it's not really food. When we eat something that's packaged or wrapped up in a box, it becomes us to really look at that ingredients and look at the food label, because if we're not doing that, what we're missing out is that what's in that package, a lot of those items, a lot of those ingredients are preservatives and chemicals, and we're thinking that it's food. And so a big part of this is re-educating yourself. Understand this, the FDA has approved approximately 3,000 food additives, preservatives, and colorings. And the average person ingests 150 pounds of these additives every year. Many commonly eaten foods are genetically modified or contain genetically modified ingredients. So first is first. You got to understand what some of these additives are. This is just a chart or a diagram listing what a lot of these common processed foods contain. These are a number of the different chemicals that we can find within the food. Many of these chemicals contribute to leaky gut. Many of these chemicals contribute to chronic inflammation. Even though they're generally recognized as safe by the United States government and the FDA, just because they're recognized as safe doesn't mean that they are. Remember, a lot of these chemicals were recognized as safe not because they went through rigorous study, but because we've been using them so long, the government just said we're going to grandfather a number of these chemicals into the safe list. And as we move forward, we may do additional testing on newer chemicals, but these older chemicals, we're going to grandfather them in, and a lot of these fall under that category. Pesticides. Pesticides are a big part of our food today. There's 3 million tons of pesticides used every year worldwide, more than 16,000 chemicals used in the production of pesticides. And most have not been tested for their toxic effects in humans. We've got small-scale mice studies. We've got very short-term human studies, but not all of these chemicals have actually been tested for their safety. But we do know that their exposure has been linked to things that are not safe: nervous system disorders, immune system suppression, cancers, diabetes, reproductive damage, hormone issues, hormone problems like thyroid problems, estrogen problems. We know asthma and ADD and autism and migraine headaches and developmental delayed disorders in children. All these things have been linked to chronic pesticide exposure. We know that there are toxins in foods, in these pesticides: the herbicides, the steroids, the hormones, the antibiotics, and excitotoxins. These are all chemicals. And here's the thing. It takes 5 to 8 pounds of chemically sprayed grain, to produce 1 pound of beef. This is one of the reasons why I'm such a big advocate of grass-fed beef versus grain-fed beef. It's because grass-fed beef does not contain anywhere near the quantity of chemicals. You remember, just to produce the grain, you're spraying it with fungicides and other chemicals that mimic estrogen, that increase the risk of cancer, that damage the health of the animal, that change the nature of the type of fat in the meat, that make the meat inflammatory. And so you will ingest, if ingesting that type of animal, you will ingest considerably more cancer-causing chemicals from meat than from fruit and vegetables. Now, that's not to say that I'm an advocate for the vegetarian diet. That's simply to say if you're eating meat, you need to be eating quality meat. Meat that, if it's beef, it needs to be grass-fed. If it's fish, it should be wild-caught, not farm-raised. Because remember, these industrial farms are feeding these animals chemically sprayed grains in large, huge quantities. And those are things that are ingested into the animal's tissue that then are ingested into your tissue as you eat them. And you want to do your best to avoid that. So again, on average, 1 glass of inorganic store-bought milk contains the residue of about 100 different antibiotics. And once in our body, remember, these antibiotics will weaken your immune system. They'll crush the probiotic environment or the microbiome within your healthy gut, and they'll contribute to a breakdown in your gut function and ultimately lead and contribute to intestinal permeability, or aka leaky gut. There's also excitotoxins in the food. So the hidden toxin in packaged food, things like MSG or monosodium glutamate, These things act as neurotransmitters. Remember that your gut is a nervous system, and generally speaking, it's actually got more neurons than your entire spinal cord. There's more nerves in your gut than your entire spinal cord. It's the second biggest conglomeration of nerve tissue in our body, second only to the brain. And so these excitotoxins in the food will affect the nervous system within the gut as well, and that can create and contribute to endocrine and exocrine disorders. It can contribute to diabetes or obesity. It can contribute to reproductive disorders. So again, these are things you want out of your food. You want to eat without having these unintended consequences. Now, medications are another big piece of this puzzle. This is a copy here of a pretty good book that was written by Ross Pelton and his group on the drug-induced nutrient depletion effects of many medications. In other words, the things that your doctors don't tell you about when you're starting that statin drug to lower your cholesterol is that drug will also lower your vitamin D, and it will also lower your coenzyme Q10, causing muscle fatigue and increased blood pressure and congestive heart failure and a weakened immune system. So we don't want to be the victims of the unintended consequences of drug-induced nutritional loss. Remember, when you get into that model, that medical model of treating disease with drugs, you're not really treating anything. You're actually artificially manipulating chemistry without impacting why the disease is there in the first place, and that never works. As a matter of fact, the only time drugs really ever work, there's a couple of different scenarios where drugs are definitely the right move. One is if you have a life-threatening infection and you need an antibiotic, then by all means don't die, take the antibiotic. Another is if you're in a life-threatening scenario that requires surgery and you need pain medications in order to not go into shock to have your life saved. We have great emergency medicine in our country, but when it comes to chronic disease, we have the worst health care in the world, and you don't want to get into that trap of medicating chronic disease. This is a chart, an example of some of the most common drugs that impact your gut function that can contribute to leaky gut. So if we look over here on the left, antibiotics destroy good gut bacteria. Even their best intention, they still destroy good gut bacteria. That can hinder digestion, can hinder vitamin synthesis, lead to irritable bowel problems and nutritional diseases. But it also, when you destroy your good bacteria, you're increasing your risk of future and subsequent infections. So long term, you're weakening that immune system. Anytime you want to go on an antibiotic, if it's there to save your life and you absolutely need to take it, then by all means do so. But know that you need to replace those good bacteria, and so to do that, that requires a couple of months of taking anywhere from 2 to 400 billion colony-forming units of lactobacillus and bifidobacteria and other healthy probiotics. So don't ever get stuck with an antibiotic where you don't follow through with a good probiotic at very, very high doses. One of the other most common drugs is pain relievers. And one of the reasons I wrote the book No Grain, No Pain is because pain is such a prevalent problem in our society, grain being one of the original causes or one of the main causes of it, and pain relievers being one of the main ways that we treat it. But realize this, that pain relievers like ibuprofen and naproxen and Celebrex, they erode the lining of the stomach. They rip the lining of the stomach out and erode the mucosal layer. And so what then happens is that opens the gut to potential damage, and it contributes to the leaky gut process. So if you're chronically in pain and you've gone gluten-free but you're still in pain and you're using ibuprofen a couple times a week, realize you're never going to heal that leaky gut because you're eroding your mucosal barrier. It's one of the primary barriers within your gut that prevents it from becoming leaky. And so again, that in and of itself long-term is going to contribute to autoimmune disease. Pain relievers also contribute to vitamin and mineral deficiency. Folate deficiency, vitamin C, and iron deficiency are caused by ibuprofen and aspirin. And then we have the category of acid reduction medications, which cause our stomach acid function to be minimized, which hinders the digestion of nutrients, protein, calcium, vitamin B12, and that leads to, again, we need those nutrients for a strong immune system. And that can, but those nutrient deficiencies tend to cause a lot of pain. A lot of bone pain, a lot of muscle pain, a lot of anemia where we don't get enough oxygen because we become anemic and we can't get enough oxygen to our tissues, so our muscles become more tense and more tight, and we develop pain syndromes and joint problems. And so again, these are the long-term consequences of being on these medications for longer than a couple months. I mean, these drugs were never designed to be taken for the rest of your life. They're really designed to be used in the short term while you took action and changed your lifestyle so that you didn't need them anymore, right? The antidepressants themselves actually can alter gut motility because they affect serotonin. 90% of the serotonin is made in our gut. So when we take an antidepressant, a lot of the times people's guts are affected more than their brains. And that process can oftentimes contribute to constipation, which leads to altered gut flora and increased toxic colon burden. So again, these are just some examples of some of the most common drugs and how they impact the GI tract and contribute to leaky gut problems. Now, just some statistics for you. The top 10 reasons people visit their doctor: skin disorders, joint disorders, including osteoarthritis, back problems, cholesterol problems, infections like upper respiratory conditions, and then we have anxiety and bipolar diseases, chronic nerve diseases, high blood pressure, headaches, migraines, and diabetes. And so I point that out because if you look at those 10 conditions and then you come back here and you look at these 4 classes of drugs, you're going to see there's a lot of overlap between the top 10 reasons people visit their doctor and 4 of some of the most common classes of drugs that are prescribed. And so the trend there is, if people go to the doctor with those conditions and receive these drugs, and they're on these drugs and these drugs are wrecking their gut, and now we're in a catch-22 scenario and we can never heal. As long as the gut's leaking, we're not going to heal. Now, of special note, I wanted to bring up something because this is there are a couple of new studies that have come out in the last couple of years on blood pressure medications. If you're on a particular drug called Olmesartan, it's a type of blood pressure lowering drug that has actually been found and shown to create the exact same kinds of symptoms and the exact same kind of damage as celiac disease. And there are now people being diagnosed with celiac disease who actually have Olmesartan toxicity, and they don't really have celiac disease. So this is just one of those classes of drugs, or one of those types of drugs, that has been shown to mimic the classic manifestation, or the classic presentation of gluten sensitivity. And so, as you can see from Dr. Murray from the Mayo, this is a quote from him: "We thought these cases were celiac disease initially because their biopsies showed features very like celiac disease, such as the inflammation. What made them different was they didn't have the antibodies in their blood that are typical for celiac disease." So here again, we got these patients being treated for blood pressure, developing leaky gut and celiac disease symptoms as a result of that. Now let's look at the top 5 prescription drugs that are dispensed. We've got drugs for pain, drugs for cholesterol, drugs for blood pressure, for thyroid, for acid reflux, and antibiotics. Again, going back up a couple of slides that I showed you a moment ago, those classes of drugs that affected and impacted the gastrointestinal tract. If you're on a thyroid medication, as just a note for you, if you're on Synthroid, realize that if you're trying to be grain-free, Synthroid actually has cornstarch in it. It also has dairy in it. And this is one of the patterns that I see in many people who are going grain-free and they're feeling so much better, but they can never shake their thyroid medication because the thing that they're taking to help their thyroid is actually the thing that they're taking that's continuing to destroy their thyroid, just in smaller doses. This I call this the gluten sensitivity HYDRA, because if we focus on symptomatic treating, and again, the focus in mainstream medicine is see symptom, treat with drug. If we focus and we use that philosophy, what typically ends up happening is the drug ends up creating a secondary or a tertiary set of problems. And so now, maybe the drug helped with the pain, but it created a leaky gut that led to a different kind of pain, or that led to a different kind of disease, or a different type of problem. And just like in Greek mythology, if you chop off one head of the Hydra, it sprouts 2 new heads in its place. So if you chop off one of these symptoms using a medication, you're just going to get 2 new Hydra heads in the place because of the medication side effects, the unintended consequences of medications. Okay, this is another diagram, just to, using an example of taking acid blocking medications and the impact that has nutritionally. So again, this is, again, imagine you're treating acid reflux using an acid blocking medication. So in essence, the analogy is you're chopping off one of those symptomatic heads of the Hydra, but look how many more heads you're creating in the process. Zinc deficiency, folate deficiency, vitamin A, protein, calcium, iron, and vitamin B12 deficiency. All very, very common manifestations of being on acid blocking drugs. So, we've got this compounding damage effect. We've got 4 billion prescription drugs ingested in the U.S. each year. 70,000 chemicals used commercially in our foods and in commercial industries. 3,000 chemicals are added to our food supply directly. 10,000 chemicals are used in food processing, preserving, and storage. And the EPA estimates that our homes are now 5 to 100 times more toxic than outdoor air because of the tighter seals on the windows, because of the chemicals that are being used to produce a number of the things that we take advantage of. So that's a lot of compounding damage. What do we do? How do we figure out this puzzle? So starting with fundamentals is the first piece. If we're going to cure a leaky gut, we've got to begin with fundamentals. So if you've changed your diet and you're feeling better, but you still have existing disease, this is kind of a flow chart I've developed. And I actually use this flow chart in the training of doctors across the world. But you see, if yes, if existing disease, if yes, rule out the following: vitamin and mineral deficiencies, infectious pathogens like infections, right? Gluten sensitivity if you haven't already. Rule out other allergies, and that could be environmental allergies, it could be chemical allergies, it could be food allergies. Rule out the presence of toxic metal burden. Rule out gut integrity problems or dysbiosis problems. So there are ways that we can fundamentally investigate these processes. A good functional medicine doctor should have an arsenal, a tool belt where he can run specific and specified types of labs that will help give you the answers to many of these questions so that you can address each issue as it relates to you. How many times have you watched a summit or listened to another doctor talk about, do this and do that and take these 4 steps or these 3 steps or these 5 steps, and you did it and you felt better, but you still had problems? And the reason why is because on any of these summits and any of these webinars, doctors have to generalize. They can't be specific to you as a unique individual. They're generalizing and trying to give best practice information to large groups of people because they're trying to make the biggest impact and the biggest change, because they can't work with you one-on-one in a webinar format or in a summit format. So the information might be great, but some of the information might not apply to you. And so my point and my premise is starting with fundamentals means finding out what is unique to you, what is unique to your body, what your body needs, versus trying to guess. In other words, guessing can be effective to a point, and many people do get better when they guess, but they don't fully recover, fully heal. If you're one of those people, you need to take this diagram to heart. You need to get in touch with a good quality, high quality functional medicine doctor who's versed in being able to use these lab diagnostics to help develop a blueprint that you can follow, as opposed to guessing about what to do next. And the key here is that you need to have this information simultaneously. You can't start here, try that for a little while, and then come over here and try this for a little while, and then come over here and try that for a little while. It has to be done simultaneously, because if it's not, you're just going to be chasing your tail. You're going to be chasing the next symptom. So again, healing requires more than just gluten, okay? More than just removing gluten. You've got to correct nutritional deficiencies. You've got to identify adverse food and chemical reactions and avoid them. You've got to assess the status of the GI tract. If there's a GI infection or a yeast overgrowth, it has to be dealt with. These are all fundamental things that have to be investigated, fundamental things that have to be done, and they have to be done simultaneously. They can't be done in pieces. These are 5 of the critical elements for healthy gut function. In essence, if you want a healthy GI tract, if you want a healthy gut that is not leaking, these are the 5, what I call the 5 primary barriers that protect the integrity of your gut function. And so you can see on the left here, GALT. GALT stands for gastro-associated lymphoid tissue. Imagine the GALT, it's almost like a set of tonsils in your intestine. It's a set of tonsils that wraps around your intestines. It represents 70 to 75% of your entire immune system. So the GALT is ultra critical for your immune system's overall function, and it's concentrated right behind your gut wall. The next barrier is the tight junction barrier. And this barrier, tight junctions, are what prevent things from leaking through into your GALT. Remember, your GALT is the last barrier. It's the last man standing. If things are leaking into your GALT, and it's like you're at war. Every time you eat, there's a battle that ensues because the food and the chemicals in the food are just leaking right into your immune system, triggering immune reactions. So if the tight junctions are breached, the immune system is on high alert, and it's chronically on edge, and it's chronically attacking the things that are coming in. And so this is one of the processes that occurs in autoimmune disease that has to be stopped. We've got to calm the immune system down by being able to seal the gut. But in order to seal the gut, we've got to recognize that tight junctions can be dismantled by a number of different things. I'm going to talk about a little bit about that in just a moment, what things you need to be avoiding within your environment so that you can maximize the integrity of your tight junctions. The third barrier is your mucosal barrier. This is the lining of mucus, and inside that lining of mucus, over your cells in your GI tract, you make an antibody called IgA, immunoglobulin A, and it's your first line of defense. You actually make this antibody in your saliva as well. And so this antibody is a lot like handcuffs. It will bind to things that it sees as a potential threat, so that your immune system doesn't have to attack them. It'll bind them and it'll push them out into your stool. Then we have the friendly bacteria, the fourth barrier. Very, very critical. The friendly bacteria, again, they talk to your immune system. The friendly bacteria talk to your gut about what is good and what is bad. So they send messages back and forth to each other. If you don't have the right kinds of friendly bacteria, we get a miscommunication and your gut becomes overreactive. Remember, an overreactive immune system is a precursor to autoimmune disease. And then we have the fifth barrier. This is the stomach acid. The stomach acid is very, very critical for defending you from infections. When you eat all kinds of bacteria and parasites and yeast. It's a normal part of our food. And just because it's there doesn't necessarily mean that we have to be impacted by it in a negative way. Part of how we're not impacted by it in a negative way is our stomach acid can kill a lot of those things before they're able to get down into our intestine. The stomach acid is also very critical for the absorption of nutrients that are necessary for our immune system to function appropriately. And so these five primary barriers need to be evaluated. This is one of the things that if you haven't had evaluated and you're still struggling, the very first thing you need to have a doctor do is evaluate those 5 barriers before doing anything else. Now, I said before, I talked a little bit before about perspective, and I said that, look, this, generally when people have autoimmune disease, it's the accumulation of decades of damage, and so you want to have a realistic expectation of how long it might take to heal. Healing can fully take 3 years. Now, for most people, we're going to see dramatic change and improvement within the first couple of months, but we're not going to see full repair and full recovery for up to 3 years. Most people, if they're super compliant with their diet and with their protocols, can get better within about 18 months. So there's this range of 18 months to 3 years that we're actually realistically looking at if we're doing things correctly. Step 1 is we have to remove the bad. So if we're trying to recover the gut, we've got to remove the things that are affecting the gut in a detrimental way. Food allergies, toxins in the environment, infectious microorganisms, and then GI-altering medications. Those things have to be removed if we're ever going to make an impact or a dent in somebody's long-term health. We have to replace and repair. We've got to replace and repair. So we got to replace good bacteria. We've got to put good food in so that we're replacing the lost nutrients. We've got to replace the environmental nutrients. When I say environmental nutrients, I mean clean air. I mean sunshine. Those are environmental nutrients, things that you don't necessarily eat, but things that you need to be getting exposure to, because the nutrients you'll get from those are critical in your gut's ability to heal and repair itself. But part of repair is calming the inflammation. Removing the bad takes away the fuel for the fire, but doesn't put the fire out. And one of the things that we have to do is we have to put the fire out. And that might take, for some people, that takes certain types of supplementation, or it takes certain types of food, or it takes certain types of fasting. There are a number of different mechanisms, a number of different action steps that we can take to do that. And then the last step here is the restoring and the maintaining of the healed GI tract. So the healing phase, we have to work on building a solid foundation of health. We have to do the things that are necessary long-term to maintain what we're setting out to achieve. Exercise, rest, sunshine, stress management, positive thoughts. These are all critical, fundamental, foundational things, and they have to be in place if you expect to maintain the health once you actually start to repair and heal your body. These are the healing, so these are kind of the healing essentials if we're going to heal a leaky gut. Number 1, we have to test for specific food and environmental toxic exposures. We have to find out what they are as what they are for you as a unique person. Now, you remember the diagram I showed you earlier about all the different mechanisms of allergy? I have so many patients come to my clinic and they have been tested for food allergy, but they've only been tested for IgG and IgA. Remember I showed you IgG and IgA and IgM and IgD and immune complex and T-cell responses on that slide earlier. You need all of those things tested. Don't just stop at IgG and IgA. Those are limited tests and they're not going to give you all the knowledge that's required to remove what you need to remove. So we need to identify what those things are and we need to remove them. You want to test and address, test for and address any type of underlying infection, and yeast overgrowth is common, but so is bacterial infection. I see bacterial infection in GI tracts all the time on a weekly basis in my clinic, and it's extremely common, and so you want to make sure that that gets tested for. But you also want to test for under the same type of aspect. You want to test to make sure that you're producing digestive enzymes, because sometimes your pancreas is so damaged and your gut is so damaged and they're not making enzymes. So you could do all the things right, and you could be eating all the right food, but you're not able to process the food. So because you're not making enzymes, and if you're not making enzymes, you can't get the nutrients from the food, and you can't correct nutritional deficiencies with food. So it's important to test for gut function. Part of testing for gut function is testing for gut infection, but we also want to test for digestive capacity. We want to identify nutritional deficiencies because certain nutrients are critical for the healing process. Many of you I know have heard about taking L-glutamine as a nutrient to help heal a leaky gut. Well, for some people, L-glutamine is not necessary. We can actually test for L-glutamine deficiency. So again, not taking a gajillion supplements just because you think that's what's the smart thing to do because you heard it. You heard that this was good for that and this was good for that, but being very, very specific, knowing what you need to take so that you can target it. Knowing what you need to take and targeting what you need to take saves you tons of money, but saves you also tons of pills, potentially, and tons of time in the healing process. So identifying very specifically what you're deficient in is a very, very important part of the process of healing. And then sometimes we have to perform detoxification, repair, and support protocols. But we want to do these things, again, we want to do these things in a manner that's unique to you, not in a manner that's generalized, not in a manner that says, okay, take this formula, and this formula will fix all of your problems. No, the formula is not going to fix all your problems. We can identify what the unique aspects of you as a person, we can identify those things, and then we can create a protocol unique to you. Okay, formulas are good for general help. But they're, again, if you're struggling, if you've already gone the formula route, if you've already tried this product and that product, understand that it's important that you do these other three things at the top here first so that you get the best results and you get the long-lasting results. You get results that actually work. Now, these are the known causes. In other words, we look at medical research. These are the things that have been scientifically documented to create and cause leaky gut. Gluten being one of them, GMO foods, genetically modified organisms. Plastics, heating up food in plastic, drinking or eating out of plastic, pesticides, aggressive exercise. I'm not talking about a regular normal exercise. I'm talking about the kind of exercise where you get to the end of the workout and you want to pass out or throw up. That type of exercise has actually been shown to cause intestinal hyperpermeability. I showed you a number of medications earlier that can contribute to leaky gut. Infections, yeast, bacteria, parasitic infections, prion infections, things like Lyme disease, things like H. pylori infection. There are a number of different aspects here. Food allergies can contribute to leaky gut. And I put potatoes here separately. I mean, we could say food allergies and potatoes, but potatoes have actually been tested. There's a compound in potatoes that's actually been shown to contribute to leaky gut. So one of the things that we're trying to do when we want somebody to heal in the initial interim is we really want to take white potatoes out of their diet, even though they may not be allergic to them, because the compound in white potatoes can actually cause a breakdown in your gut barrier. So again, this is just one of those things that in research has shown to contribute to leaky gut, not because it's an allergic reaction, but because it's a particular compound in the potato itself. So when we're dealing with infection, there are a number of different ways, and I've given you some different examples, and some of these are specific formulas that I've developed over the last 15 years to address these particular types of things. So if you've been tested and you're looking for something that might be beneficial or helpful, Yeast Shield is an example. Ultraberberine is an example. Now, I have a form of biotic defense with a type of bacterial, a type of agent called Saccharomyces boulardii, which is effective for yeast overgrowth. And then the avoidance, the dietary piece to this is the avoidance of alcohol, sugar, dairy, processed fruit juice, dried fruits, foods that are prone to heavy mold exposure like peanuts, excessive carbohydrate intake. And when I say excessive, I mean more than 15 grams of carbohydrate in a single sitting would, and then when I say not complex carbohydrate, but simple carbohydrate. So more than 15 grams of simple carbohydrate in a single sitting is going to be one of those things that allows yeast to continue to grow and prosper. Remember that the byproduct of yeast and sugar is alcohol, and you don't want your gut to be a distillery, because alcohol is one of those things that can also contribute to leaky gut. For parasites, there are a number of things that can be done. Again, a couple of different formulas here that are very, very helpful. Using vitamin C to do gastrointestinal flush outs, can sometimes flush out large balls of worms, can sometimes flush out large bodies of parasites if you should happen to be diagnosed with a parasitic infection. And then bacteria, there are a number of things: ultra garlic, berberine. There are a number of compounds and formulations. There are also a number of foods like sage and thyme and oregano. These are all different kinds of foods that have antibacterial and antifungal garlic, and have antifungal actions. And so these, things can be done with food in conjunction with supplementation. My advice to you is, again, get tested. Get tested. If you have yeast and you know it, and because you were tested, then you can have an approach that is very, very systematic, and it's very, very regimented and targeted, as opposed to, I think I might have a yeast infection because 7 of my symptoms match what I read on the internet. Test it. Make sure if it's there, follow through with what you need to do to be able to get rid of it. Because if you're guessing it, again, if you're guessing and guessing and guessing and guessing and not getting better, you got to learn the lesson at some point. Quit guessing and get specific. Helping repair inflammation. There are a number of things that you can do. So again, if we're trying to heal the leaky gut, we remove the things that we know that can create it, but now we need to repair the damage. And so healing broths and organic foods are a big part of that. Food in and of itself is a big part of how we repair. Remember that 40% of the nutrition that your gut cells receive doesn't come from the bloodstream. It actually comes directly from the lumen, or from the intestine itself. So the way your gut gets a good majority of its nutrients is from the food that you eat. So the food becomes very, very critical. Broths work really, really well, like bone broths and vegetable broths work really, really well. Juicing works really, really well. One of the reasons why is because it's less for your gut to digest. In other words, your gut's in disrepair. It's not capable of functioning the way a normal gut functions. And so you don't want to bombard it with a lot of difficult to digest foods. You don't want to bombard it with a bunch of things that it has to break down if it's not working properly. You want to give it things that are easy for it to digest, easy for it to assimilate. This is why broths, organic juicing, and pureeing can be so effective. Now, some of my patients, we actually do what's called intermittent fasting with them, because we want to give the gut a prolonged break. Remember, the GI tract needs a break too. Think of the gut like you would think of your muscles. If you worked out 7 days a week, twice a day, and never gave your muscles a break, you'd eventually have training failure. You'd have injury. You'd sustain damage that was long-lasting and that created injury and hindered your ability to train in the future. Well, your gut's the same way. If you're eating 6 meals a day and you never give your gut a fast, if you never give it a break, then it has a really hard time recovering and healing. Intermittent fasting, in a nutshell, the most simplest aspect or way to do intermittent fasting is to pick an 8-hour window in the course of your day and eat all of your meals within that 8-hour window, and the rest of the 16 hours is a fast. And this gives your gut a prolonged period of time where it's not being asked to work. It's actually being allowed to heal, to sleep, and to repair itself. Now, I wanted to give you a list of supplements that clinically work. There's a lot of information out there on the internet about, okay, use this product, use that product, but I want to give you some actual things that are tried and true, that are clinically tested. One of them is vitamin C. It's one of the most potent and powerful ways to heal the inflammation within the gut. And there are a number of studies that show the efficacy, both clinical studies as well as research studies that show the clinical efficacy of using high doses of vitamin C to heal your gut. One of the things you do have to be aware of, though, is that, and one of the reasons why I actually ever even designed my own vitamin C product in the first place was because 90% of vitamin Cs that are on the market are actually derived from corn. And if we're trying to avoid grain byproduct, this is one of the places people get cross-contamination of grain in their diet when they're trying to heal. And they'll be taking a product, and it might help them. The vitamin C might help them in one way, but it's the corn aspect of it is damaging them in another way. And so they get stuck in this kind of paradigm loop of not healing. So you've got to make sure that it's a corn-free vitamin C, and 5 to 10 grams a day is a good dose to start with. Vitamin D. Vitamin D is critical for bolstering the immune system and regulating the immune system. And one of the freest and cheapest ways to get vitamin D is sunshine. Now, if you live above 27 degrees north latitude, it's harder to get enough vitamin D, especially in the winter months. So from a dosing perspective, 5 to 10,000 international units per day is a good place to start as well. And it's a very, very potent anti-inflammatory. Ultra turmeric is a product I designed, again, because a lot of your turmerics are also cross-contaminated with corn. Turmeric is a very, very potent herbal that has very strong anti-inflammatory properties. We said before that ibuprofen as an anti-inflammatory will actually break a hole into your mucosa of your gut lining. Well, turmeric has a similar mechanism of action of ibuprofen, but doesn't cause the leaky gut process. And so turmeric, it can be used at higher doses, about 1.5 grams of concentrated curcuminoid. That's the compound in turmeric that's anti-inflammatory. It's called a curcuminoid. So you want a turmeric that's concentrated, 90 to 95% concentrated curcuminoid, and the dose is about 1 to 1.5 grams per day. And Inflame Repair is a product that I created. Actually, it has boswellia and turmeric and skullcap in it, and propolis in it, bee propolis, and all these things are inflammatory. And actually designed it as a synergistic formula in patients with Crohn's and ulcerative colitis. Those are both inflammatory bowel diseases, and so we originally designed it to go with those patients to help them wean off of their inflammatory medications. So it's a very, very effective product. Ultraimmune IgG is a colostrum-derived antibody formulation, and this can be extremely effective, especially if you have inflammation within the gut and you also have an infection that's been identified. This actually helps, one, fight infection, and two, helps to soothe and support the inflammatory process. And then a good quality probiotic. Biotic defense is about 400 billion colony-forming units a day is the dose. There are a number of probiotics that are out there on the market, but the vast majority of them don't hit the mark in terms of hitting that 400 billion colony-forming unit dose in a serving. Most of them are somewhere in the neighborhood of 10 billion or up to 50 billion, but very, very few actually get up into those high doses. And the one that I know of, there's one on the market now that's used, and a lot of people use it, called BSL, and that particular product actually has corn in it, and I wish they'd get the corn out because it would otherwise be a very good product. But I might even use it if it didn't have the corn in it, but that's just not the case. So again, I was forced to design my own that was just as strong of a dose because corn is such a pervasive filler in the market of the supplement industry. It's also essential to restore gut motility. So, some things that we can do that you need to be doing: fiber in the diet, okay, but if your gut is somewhat compromised and damaged, fiber can be one of those things. It's a double-edged sword, because it can be hard to digest because you don't have enough good bacteria to help you digest it. So fiber is one of those. Work it in and build it in slowly, but also be aware of the foods that contain high quantities of FODMAPs. FODMAPs are difficult to digest carbohydrates, oftentimes found in foods that contain high fiber. And for many people, FODMAPs can mimic gluten sensitivity, can contribute to irritable bowel syndrome, so can actually cause constipation or cause diarrhea and create bowel dysfunction. So just be aware of that. When you're introducing fiber, go slow. I prefer using vegetable fibers from whole foods as opposed to fiber powders or fiber supplements. But if you need a good fiber supplement with vegetables intact, I do have something called Ultra Food VF. It's available online. You're more than happy to go and look at it. You're more than welcome to go and look at it. But I prefer food as a source of fiber. Water is critical and essential too. And there's not a magic number. Some people say 6 8-ounce glasses a day. Some people say 8 ounce glasses a day. Some people say take your body weight and cut it in half, and that's how many ounces a day you should drink. Look, water is important. You should be drinking water at room temperature because water that's too cold actually causes a blood restriction to your gut and prevents you from being able to digest your meals. So as you're drinking water with your meals, make sure that you're drinking it at room temperature. Now, some people will also say that basically drinking water with your meals makes it harder for your food to be digested because it waters down your enzymes and waters down your acid. That's not actually true, but for some people, drinking water does create that symptomatic response. So it's not one of those. We can't say that water is a bad thing to take with your meal because your body actually needs water to break your food down. But also remember that if you're taking in a lot of vegetables and fruits, there's going to be a lot of water content in those vegetables and fruits as well. So you may not need to drink as much because you're eating whole real foods that contain 60 to 70% water by concentration. And the other part to restoring gut motility is movement, is getting up, not sitting down, not chronically laying down. Remember that for your gut, for the nerves that travel to your gut to signal them to create a peristaltic reaction, in other words, for that reaction in your GI tract to properly process, that actually requires motion and movement. Those nerves in your spine that feed your GI tract, they need to be moved and they need to be pumped. And the only thing that does that, or the thing that does that the best, is walking. And again, it doesn't have to be super aggressive exercise, but just walking. So the recommendation for movement is anywhere between 8,000 and 10,000 steps a day. Supplements that clinically work for replacing and repairing. I have a formula called GI Soothe that is a mixture of aloe vera and it has glutamine and it has licorice and marshmallow and a number of other things that will, for somebody who's got such severe inflammation and ulceration in their GI tract, and we're just trying to coat it so that even eating broth doesn't irritate it. We're just trying to get a coating down so that their body can actually heal in the very beginning. This is something that we use in the clinic a lot of times with patients because the damage is so extensive. So it's one of those things that can be used as a coating for the GI tract while it's trying to heal. L-glutamine is something else that can work very, very well again, but we can test for L-glutamine, so it can work, but it's not always necessary, and a lot of people take it unnecessarily. And the doses for L-glutamine can vary, but the average therapeutic dose for glutamine is 2 to 5 grams a day, just depending on your weight and depending on how you respond. Sometimes for some people, glutamine can actually trigger diarrhea. For some people, glutamine can actually trigger migraine headaches. So you gotta be aware of those things if you're gonna consider using L-glutamine in your healing process. And then again, replacing the missing micronutrients. You've got to replace the vitamins and minerals that are missing. I recommend having your doctor run a lab from a company called SpectraCell, and that'll give you probably the best look at what vitamins and minerals you're deficient in. Sometimes replacing enzymes becomes necessary because, again, the gut is so damaged and the pancreas is damaged, and so you're actually so damaged that your organ reserve of being able to produce enzymes is diminished. And so just the act of eating is just overwhelming. And this is where, some people tell me I'm allergic to everything, and it's not that they're allergic to everything, it's just that they can't digest food very well, so every time they eat, it's not comfortable. Every time they eat, they're having symptoms, not necessarily because there's an immune reaction occurring, but because they're not processing or breaking or digesting their food down. So digestive enzymes and that last thing on the list here, this ultra acid, both can be extremely effective. If your stomach acid reserve, if your stomach cells are damaged, not producing enough acid, or if your pancreas or intestinal cells are damaged, not producing enough digestive enzymes. One of the hallmark symptoms of low stomach acid is actually constipation, even though you're eating plenty of vegetables, even though you're eating plenty of fiber. So if you find that you're that type of person, then this might be, replacing your stomach acid might be a really, really smart move to help overcome that. And again, I want to reiterate, because I'm talking a lot about supplements just because I want to be able to give you guys some viable solutions as you walk away from this webinar. But I want you to understand something else. My intention is not for anyone to ever be on supplements for the rest of their life. Supplements are used as a clinical supplement to help guide the healing process, to help accelerate the healing process. Sometimes they're necessary because the damage is so extensive that we've got to put these nutrients in place just to get a person to respond. But at the end of the day, supplements are not something that you should be kind of shackled to in order to maintain your health. You should be able to get to a point where you're not having to take, gobs of pills or gobs of potions or gobs of different types of supplements, where whole food and real food and the right lifestyle choices are the things that are in place that are helping you heal. Now, if you any of these supplements, if you want to try them and you want to use them, I do have a promo code you can use. Again, I just want to get you the help, and I want to be able to save you money in that process. So if you find that you might need any of those things that we talked about tonight, you can go to Gluten Free Society on the shop button and just use the promo code Leaky, and you'll save 15% off your order. The other thing, if you want to dive more into this and get much deeper information, again, it's one of the reasons why I wrote No Grain, No Pain. You can get a copy of the book at this website, nograinnopain.com. But in addition, if you pick it up now, you'll also actually get a coupon kit. There's about $200 worth of coupons and exclusive information, and then there's a starter kit that kind of gets you going in the right direction. And so, take advantage of that. If you're thinking about getting the book, go ahead and take advantage of that opportunity and get those bonuses as well while you're doing it. So again, you go to that website. Don't just go to Amazon and buy it. If you go to this website, it'll instruct you on how to get those coupons. Because if you're going to buy the book, I'd rather you buy the book and get the freebies, because the freebies are actually more than the value of the book. So I want you guys to have those things. We put those together so that you could take advantage of them. Many of you have inquired about my clinic. Look, I'm booked out for many months at a time, but I still take new patients. I'm passionate about staying in the clinic. I'm passionate about treating people. It's the biggest and most rewarding thing in my career. It's the biggest and most rewarding thing that I do on a day in and day out basis. So I'll never quit taking new patients, but you may have to wait a while to get in to see me. And because so many of you have asked, that phone number is there. You can also visit my clinic website at drpeterosborne.com, and you can visit our foundation at glutenfreesociety.org, and there's a lot of great free resources that you can tap into on both of those websites. So if you're looking for additional help and you're looking for more resources, those are just two areas I'd recommend that you go to. And so that's the end of the lecture tonight. So again, if we kind of summarize, it's best not to guess. It's best to go in with a plan of action. In order to do that, you really need to, ideally, if you're struggling, you really need to find a good functional medicine practitioner who has the right tools and the right ability to run the right types of diagnostics to get you the kind of help so that he's not guessing or she's not guessing and you're not guessing. Again, it's so much easier once you take the guesswork out to heal a leaky gut. But the things that I gave you tonight should at least put you on the right path before you find that doctor, and maybe even put you on the path. Maybe your body is not so far gone and your health is not so far deteriorated that it puts you on the right path that your body can actually heal itself. And God willing, I hope that for you, and I wish that for you. So thanks for tuning in, and have a wonderful day, and we'll see you on the other side. Take care.